Live.
We're live. We're live. Right, Cam followers, we're going to have a good one tonight. I know that 45 people were interested and 138 people are thinking of coming. So please show your faces. Tonight, I have got the awesome Dr. James Hunt back again, who has got such passion for this topic. He really, really is going to leave you feeling empowered to create really great pain management plans for your dogs, because that's what we all want. We want optimal pain management for our pets. But before I start and let James introduce himself, I'm going to quickly say thank you to our sponsor. So, Big Barker, yes, it's a dog bed company, but hell, these people have got it right. They market this bed as offering pain relieving properties, improving, joint mobility, etc., etc. And they put their money where their mouth is, because they actually proved it with a pilot study that was conducted at the University of Pennsylvania, which is a very, very well-respected university in America. And for that, I have a huge amount of respect for this company. So thank you, Big Barker, for leading the way. And if anybody is interested, we'll put a link to their website. Right, now over to Mr. Wonderful, Dr. James Hunt. He's been here before. Please tell us about yourself.
Thanks, Hannah. I've been a vet now for nearly a quarter of a century. And always had an interest and a passion in managing pain, starting off very early on with, around the time of surgery and things like that, and trying to make animals comfortable after surgery. And just, I guess, a natural progression in seeing lots of animals with chronic pain and ongoing pain, and actually owning dogs and cats with mobility problems, osteoarthritis myself. You end up having two perspectives on it, and I think that's super helpful. So then I had the opportunity to do master's and PhD research looking at chronic pain in dogs, which was great. And
so now, I'd love to be a pig in shit with that. I just love to be surrounded by amazing tomes of information and be like, oh God, and I get to do it as a job. And I don't think it was that easy, was it? It was quite hard.
It was hard, but yeah, the people that you get to work with were amazing.
Yeah, you worked with Jo Murrell, didn't you?
Yeah, Jo and Duncan.
I'm still trying to fish for her for here. She is really hard to pin down.
She's a busy lady. Yeah.
She's a busy lady, and for all Cam followers, she is up there. She is a Louise Clark, a Gwen Covey-Crumb, a Claire Brustbridge, a Sarah. She is there. So I have lots of heroines, and she's definitely up there. So where do you work? You now work at Cave.
Yeah, so I work at Cave Specialists in Somerset as a clinical anaesthetist, and I also have my own company, Pet Pain Relief, which offers a visiting pain management service for dogs and cats in Devon and Somerset.
Amazing. So we'll put a link to that as well. So anybody that's in our locality, there is this service available. And I think it's definitely an area that is going to grow dramatically, because we're learning so much more. And today I've been on numerous calls with companies talking about the association of behavioral change and pain. So being able to demonstrate that in a practice environment is very difficult. So I can remember, having been qualified for 20 years, that behavior, they used to try and do it in a consultation, in a small slippery room, artificial lighting, big table in the way. Oh, my dog's got this problem. It's just not possible. And in 20 years, we now know behavior is best managed kind of out of the practice with time in their own context. I envisage chronic pain going that way.
Definitely.
You're a leader. So guys, tonight we're going to be trying to take some of your questions. If we don't have questions, we have something to fall back on. So do not worry, you will not be bored. On our list of things to talk about, and you can agree by saying, hey, yes, my name is, I'm from here and I believe that's a good topic. Polypharmacy, monitoring, time to effect, titration of drugs, and the multimodal approach. So if you say yay, we can do some of that. But until then, have you seen Luke's given us a massive question? Glasses are on. Okay. So
I need to get my actually.
I know. So Luke's one of our ambassadors, and he is a very, very dutiful dog owner. He's lovely. So many questions. My dog is nearly 16 and has advanced arthritis everywhere. About 10 days ago, she became lame in her front leg. Is turning in more severely than usual. Gabapentin has been introduced twice a day alongside galiprant and amantadine with a background of Librela. I can't dose 3 times a day, so asked for pregabalin, but the vet wasn't familiar with it. She does seem slightly more engaged. There is laxity in the wrist and slight swelling, but no pain on palpation. The list goes on. I'm sorry, Luke, we can't get to the bottom of the question. But this is a good topic to talk about these acute flares, because he's describing an acute deterioration and they are quite complex to manage when you think about the bigger picture. How do you kind of manage these acute deteriorations?
Yeah, definitely. The difficulty with them is that actually often you want a painkiller that's going to work relatively quickly. So for some of these, if it's an appropriate medication to prescribe for the dog, then paracetamol can be quite helpful. And actually, we're now, since I suppose the launch of Librela, and we've got some dogs established on it, we have been able to cut back, to titrate downwards their non-steroidals. They're not having a daily non-steroidal. And actually then we use the non-steroidal if they have a flare. And that seems to work pretty well.
So in this situation, he's got the non-steroidal, the piprant, the galiprant, which does limit him being able to have that kind of acute flare management non-steroidal use. Gabapentin, as you say, in experience, may take time to affect. Unless they thought that there was like a neuropathic component, if they felt that from the history that actually there was uncontrolled pain that has now flared, but it was still uncontrolled prior. Certainly, it's still good reason for them to use that one. I'm going to add confusion to the picture. What happens if it wasn't joint related? What happens if the dog tripped down a step and it's pulled a muscle? What happens if it actually soft tissue related, which we know don't tend to respond so well to our pharmaceuticals? So in these kind of situations, and you're going to all laugh at this, I have a conversation with the owner about how long this is likely to go on for. I ask what happened 2 to 3 days prior. Is there anything that we know that has triggered this? Because we don't want it happening again. And then make sure all the lifestyle arrangements are in place. Exercise is controlled and modified. It might be shorter little walks. I get the engagement and interactive feeding. I get the hide and seeks. I get all the brain games back out. And we kind of review the situation. I do always mention something like blood sampling or urine sampling, just is an opportunity to make sure that we've got our monitoring in place. And I am paracetamol as well. But things like laser, massage, acupuncture, I think can have a really good role there. Massage, believe it or not, I've had amazing results because they have pulled a muscle and they're like, I've got a trigger point.
Yeah, I think it's really helpful to actually get hands on these patients if they do have a flare up, and it's not settling down after 24 hours, rather than just assume that, yes, it's the joint and, they've maybe had an acute exacerbation of the joint pain, like you say, whether there's something else going on.
Yeah, I think there's a lot of worry. So my experience, and the person that pops out the most was a dog called Flossie, and her owner Izzy, just lovely. And we went through these acute deteriorations probably about 8 to 10 times in the time that I was her vet. And there was a huge amount of counselling, reassurance, the fact that, yes, your dog is uncomfortable, but you're doing everything you can do, and we've got to see this through a little bit, which was taught to me by my mother. When poor old Holly was struggling, she was like, Hannah, you're doing your best.
Yeah.
And, come on, give yourself a break. It's going to be a bit of time that you've got to invest in this, and hopefully we'll come out the other side. But yeah, I think that really highlights the multimodal and supporting them. I tell you what, that's something that drives me crazy. You've got a dog that's having an acute flare. let's get the support harness out. Let's lift them into positions. Let's help them down the steps. You know, they're having an acute deterioration. Ramp up the surrounding support. And it breaks my heart a little bit when people come in, and let's be honest, in first opinion practice, a lot of the times we see these dogs, they're going for a flare because that's why the owner's brought them to you.
Yeah, it's prompted somebody.
Yeah. And then they come in, and because the lack of understanding and knowledge, the dog kind of slips across the floor, slides into a laying position. The owner's there going, oh, I don't really know what to do. And the dog's trying desperately to get up. And you're like, help your dog. Let's hop them up. Let's give this a period of time for the tissue to chill out. So huge amount of support in the background, isn't it?
Yeah, very much.
Sorry, I still all space time.
No.
It's fine. My mum's visiting, so I've just had vegetable lasagna that I haven't had for years, and I think it's gone to my head. Yeah. Right, let's go for these questions. They're going to come in thick and fast now that they know you're here. This is a good one because it's going to show itself repeatedly. Where are we at?
Well, we are, I guess, in the early stages of becoming familiar with using CBD. So CBD is cannabidiol, which is extracted from cannabis plants. It's the non-psychoactive component, so it shouldn't affect their behavior or anything like that, but it has effects on inflammatory cells that can be involved in inflammation and pain within the body. So there is some early evidence that it's actually quite helpful in dogs with osteoarthritis. At moderate doses, the difficulty that we currently have is there are no licensed preparations in the UK, so it requires a vet to prescribe it off license, and it can be difficult to I guess choose a product that's got a reliable, consistent level of the drug within it, because what you don't want to do is 1 week be giving a certain amount of drug and the following week it's twice as much and the next week it's half as much. You're never going to achieve a good stable plane of pain relief that way.
It's a highly unregulated market. That's a really big stone in our shoe, isn't it?
Yeah, and I think there's definitely cases that it is helpful in. It's not without side effects, so that's something that needs to be discussed with your vet as well. But certainly, if we select cases carefully, I think it's really useful. I'm glad it's available. I wish it were slightly easier to use.
Yeah. So just to expand on what James is saying about regulation, we as professionals who have said an oath to the Royal Vet College, we have to follow the prescribing cascade. There is a code of conduct that we need to behave by. And the prescribing cascade is to keep you guys and your pets safe, in that we use interventions that have established efficacy. We know their adverse event profiles. We know what to do, what to expect. The products are very well regulated. So we know what we're giving is what we're giving it. So you have to pursue that pathway first. And I believe that we are allowed to approach these off-label after we've explored the prescribing cascade, and which goes against a lot of what people are reading online. So online, people are reading as it's naturopathic, it's the be-all and end-all, it cures everything, it's as safe as you like, introduce it early, you don't need to put them on meds, which is completely opposite to how we're allowed to use it, which is end of trying many other interventions, multiple drugs are on board and we're still not getting good control. And they're so contradictory, aren't they?
Exactly. I guess what I would say is, my consults last for 90 minutes. We go through everything. I've had some and I've reached the end, and then I've maybe talked about CBD as one of a number of potentials, And at that point, the owner says, oh, well, actually, we did try this. And, you're a long way down the line then before people actually volunteer that information. But
well, it's still considered a bit naughty, isn't it?
yeah, and I think that's the problem. So I think one of my take homes is just try and be honest. The trying to manage these cases needs a partnership between you and your vet. So all the information has to be on the table.
Definitely. And my kind of like anecdotal stories is, I've seen and heard of some dogs doing very well on it. I've seen and heard some dogs that have followed the prescribing cascade, and with it in the background, they've actually lowered the dose of other drugs, but they did follow this cascade. And we've seen results, and we've been able to remove some of the primary interventions. I've seen a lot of people bring in products going, I bought this, and you're like, that's not what you think it is.
Yeah.
So it's still a little bit unknown, but definitely talk to your vet. Do not kind of go off on your own. Just because we've got to be fair to all interventions, what kind of adverse events are you seeing so people know what to expect?
So in the main, it's actually fairly well tolerated. You don't get much in the way of vomiting and diarrhea and upset tummies and things like that. Most of the studies do report an increase in the level of one of the liver enzymes in the blood called alkaline phosphatase. So definitely recommend monitoring that periodically just to keep an eye on things. But yeah, generally it's well tolerated because it's often in an oily kind of mixture as well. It can cause some tummy upsets, but yeah.
And I think it's fair to say, like many things out there, they haven't been very well tried and tested with drugs, so we don't know what's going to happen when you mix them with other interventions. I know there was one, I think there's 7 studies out now, and one was actually looking at animals that were already on polypharmacy, and it was added. So it was really a good real life study. I can't remember more details, but I can remember thinking, I relate to this quite well. But we also don't think we've got any long-term studies. We're talking about 28 days. We haven't got things that are going to say, well, what happens after 6 months? So, and I think the other thing that I would like to add is that it's one intervention that caregiver placebo, I think, goes skyrocketing.
Yeah, that's a good point. Yeah.
Can you explain that so people don't think it's just cynical me?
Yeah, well, so whenever we do anything with a purpose, prescribe a drug, have a massage, we expect to see a result. And so we bias ourselves in terms of our then perception later on. And I guess the size of the placebo effect can be manipulated by lots of things. So, if you see me twiddling needles, doing acupuncture, things like that, that tends to give an even bigger placebo effect. If you give an injection rather than have a pill, you get a bigger placebo effect. And so, certainly, if you've got a lot of expectation regarding the effects of CBD, because you've read wonderful things about it on the internet, there's a very good chance that you may then bias your perception of actually how effective it's being, which I guess comes on to trying to use the semi-objective measures, so using validated questionnaires and things like that to assess pain, rather than just think, oh, well, he's, he must be much better because he's having his CBD.
Yeah, definitely. And I think it's a really hard part of what we do. I'm struggling to try and get my clients to see value in doing these scorings. The amount of trees I'm killing, handing out pieces of paper that never come back. And you're like,
a form that goes on that's online now. So back online. So I've kind of transcribed it into an online form, and that seems.
Is it on your website?
It's on the kind of clinic management software I use.
Oh.
I'll send you a copy of it, and you can see what it's like. No,
perfect. Because it's very hard bringing all of what we would passionately love to do into confined consult sessions. You know, as you say, you've got 90 minutes. If I get to do a comprehensive pain clinic, I get an hour. But it's still the drive to the practice, the rush, the confusion, the waiting room, the pressures, the phones, the nurses, and trying to really instill using a questionnaire before you come in to tell me where you're at. How have we improved? Are we deteriorated? Where are we at? But objective monitoring applies to everything. It's not just CBD, isn't it? It's the non-steroidal, it's the Galliprant, it's the gabapentin, it's the laser. Nothing comes with a promise, unfortunately.
No, exactly. You know, and we're superimposing these interventions on top of a disease that waxes and wanes anyway. So you're already, you know, you're fighting a battle because you're going to have peaks and troughs in how the dog or cat is doing naturally, and then you start adding in interventions, you know, multiple interventions. So really, you do need some way of just trying to keep track and see, you know, where they were a couple of months ago, where they are now, what may have helped, what doesn't seem to be helping.
No, it's hard work. Like I do still have vets that go, are you still obsessed with arthritis? I'm like, yeah, I am. He's like, are you a bit bored yet? I'm like, no, because we still haven't worked it out. You know, as far as I'm concerned, we've still got a lot of work to do in this arena because there's a lot of unknowns and there's a lot of elements where I think we're all guddling through, trying to do the best for the pet and owner. All right, moving on. So this one's going to be a difficult one, and I'm going to be really honest. This is an area of no regulation at all. I don't know many people. I definitely don't know any vets that are prescribing home laser. I do know physios and therapists are talking about using red light therapy, which is very different. So they're very different beasts. The literature out there, again, this is secondhand information because I'm not hugely current in this area, but the studies that are looking at laser and its influence on joint-related pain definitely are more the class 4 is what I've, you know, there's the one on elbow OA, which is a bit of a study. But when it comes to LED, so non-collimated light sources, I don't believe there's a huge amount out there in the vet sector, specifically for OA. But when you look at osteoarthritis and its consequences, such as trigger points, muscle tension, you know, pain elsewhere, whether these interventions can help, that is a different kettle of fish, isn't it?
Yeah, it is. And yes, if you're, you know, using, well, I guess infrared sources, really, you know, you are providing heat, and we know that heat does seem to be useful in these kind of muscle pain syndromes. But yeah, like you say, there's not much controlled evidence that I am aware of.
No, and I got my knickers in a proper twist about this in the beginning. So I can remember many times driving angrily, going, all these people just trying to take money from the vulnerable. And I got myself into a real tizwas about it. And but at the end of the day, what's to say these things don't make a difference? The owner spends more time with the dog. The owner's more observant about the dog's other consequential conditions, tension, pain, tendinopathy, you know, whatever it might be. That's a good thing. You know, we know that dogs are social animals, so having that more time with the owner, that's a good thing. We know, as you say, heat has benefit. So transference of heat, we never do studies about how great's a heat sac.
I know.
Oh, let's go and test that theory.
Yeah,
it's the price that is the problem for me, is that the marketing saying this is going to have a massive benefit for your pet, here's $300, you know, blah 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 blah. That's what I struggle with. So if you've got $300 or whatever it might be to invest, and it's not going to break your bank in other areas that have more evidence, go for your life. But I certainly can't comment on which brand. Right, moving on. Tricky subject. What's this one? Oh, okay, this is good. I love that phrase. How do I unpick? Because that is exactly it. Peel the onion. Unpick the extent of chronic pain in my 11-year-old dog who has OA, spondylosis, Cushing's, laryngeal paralysis. I'm so confused about what's causing what. There's so much panting. I'm debating adding in memantine to Previcox and paracetamol. Tried Librela, but she had significant PUPD, so stopped it. Do you know what, Lisa? Well done for putting that, because you are not alone. That is first opinion practice.
Mm-hmm. Yeah, very much. Yeah, and it's super challenging to try and determine, like you said, which is having the biggest impact. But if you're, if we're using systemic analgesics, which most of the time we are, then potentially we're going to be treating spondylosis in a similar way to osteoarthritis. And in these kinds of situations, as we were sort of talking about with the cascade, you actually do kind of follow the ladder, really. So we start off with things like the galiprants, like the non-steroidals and coxibs. Obviously, you've tried Librela, so the anti-nerve growth factor antibody, which is licensed for arthritis. Tramadol is licensed for use in mild to moderate pain in dogs, so that has a potential as well. Unfortunately, it's reported to have side effects in a significant number of dogs that are treated with it, in terms of sort of behavior change and being a bit spaced out and things like that. And then, we don't really have very good evidence about whether I should use an NMDA antagonist like amantadine or memantine, or I should use a gabapentinoid. We haven't got sort of head-to-head, or CBD. We haven't got sort of head-to-head things that say, this drug is going to be most effective in this population of patients. And it's very likely that different patients with different sort of constellations of signs and different presentations will respond differently to different drugs. So I managed to catch a bit of the International Association for Study of Pain conference in Toronto.
When was that?
Online. Oh, it was last month. So I think, yeah. There were a few online lectures. I didn't get to go to all the things that I wanted to watch, but they're talking about trying to pick up things in patients, mostly human patients, that are going to predict how they'll respond to drugs. So, kind of measuring how sensitive their skin is to pressure and things like that as a predictor of whether they may or may not respond to a drug. And in some cases and in some well-controlled studies, it looks like you might, certain populations of patients will respond better or worse to certain drugs. So it's an area that we're learning about. Still to get there in dogs.
Just going back to it and being the first opinion person now, Cushing's is so difficult. That's going to create weakness. It's going to create potentially panting, the lethargy. So making sure that you do lots of monitoring. So work with your vets, using your ACTH stim, looking for improvement in that area. The laryngeal paralysis, I'm just wondering whether a dog that is non-motile, so they're laying around, and if they're panting, I would be more tuned into it being potentially pain related, rather, laryngeal paralysis is much more biomechanical, isn't it? So it means the larynx is getting in the way, so exercise is going to be a lot harder, so they're going to be a lot more vocal. It's going to be more stertor, isn't it? So they're going to pant more. This is a hard one to unpack, really, isn't it? I think for me, if you were coming to see me, I would be trying to break it down, saying to you, it's going to be a case of suck it and see. Things are going to be like 4-week intervals of, well, let's change this and let's see what response it has. Now let's change this, let's see what. So monitoring is hugely important. I actually did have a case the other day, the Librela PUPD. Now this is totally anecdotal. The owner saw such benefit over the PUPD, the drinking more, peeing more. She said, I'm seeing such benefit. I'm gonna keep going. And the dog normalized. The PUPD stopped.
Yeah, I have seen one similar instance.
It's an area that we're learning about. We really, really are.
Yeah.
But I think you have got a very difficult one to unpack. I think a couple little take homes for me: be kind to yourself. I think, even if you're a specialist like James, you're like, good God, this is difficult. So it's not you. You're doing the best you can. Yeah. Make sure you don't neglect all the lifestyle things, and also be willing to embrace that your dog wants a relationship with you. And if that means that you really do modify your exercise routines, you find yourself doing a lot less activity, but small aliquots and much more engaged, that's still what your dog wants. Okay. So, yes, medication's hard. Lots of work with your vet, maybe seeing a specialist like James, lots of objective monitoring. Right, we've got another big one. Here we go. 12-year-old lab, very active and playful, bilateral elbow dysplasia with fragment in the left elbow, tried Onsia without results. Gave him paracetamol as well, but no difference. Tried several steroid injections into the elbow and shoulder. He got significantly worse after the last injection. He's on Librela, but doesn't want to walk up the stairs anymore. Stop sleeping on the sofa, instead sleep on the cold floor. Where do we go now? So I will say, with these questions and answers, we can't prescribe you a plan. We can just talk about your case and kind of go, yes, we've experienced this. But please at no point think that me or James is giving you a plan of action, because we haven't seen your dog. They're not legally in our care. We can only but inspire. What do you think?
Yeah, that's worrying. I would worry if he got worse after the last injection, because we do run a small risk every time, that we inject, well, anywhere in the body, but particularly into a joint, that we can introduce an infection. So I think if he's not been checked over by the vet since that, then that's definitely the first thing I would do. Because then, antibiotic treatment would be indicated. Elbows definitely seem to be hard to manage. And yes, we have some that respond to injections into the joint. Others, are on a combination of often 3 or more different systemic painkillers. So, a non-steroidal or a Pipran, and the Librela, if it suits them, and maybe paracetamol or gabapentin or amantadine as well. And excuse me, and the physical therapies that we were saying are so important, because these often get such tension in their tricep muscles because they're holding themselves rigid. They don't want to move those elbow joints. So their triceps, their shoulders, all carry a lot of tension, and they can get quite marked muscle pain there. So certainly addressing that, whether it's through acupuncture, whether it's through massage, heat packing, all these kinds of things as well, are definitely worth considering.
Yeah, I would definitely say. I think just to add just practicalities, the stairs, if you've got a dog that has got that, maybe it's time that you go, right, we together need to modify our lifestyle, because I know going up and going down is going to be really aggravating already very unhappy joints. It's very similar to a grandma, she had proper shitty hips. You move the bedroom downstairs, you don't ask them to do something that's going to aggravate. The fragment, I know a surgeon would be saying, if there's a fragment still in there, it's like a pebble in the shoe, but I don't know how you feel about that. Elbow dysplasia with fragment in left elbow, tried Onsia.
Yeah, definitely. Sometimes the surgeons will say, we should probably address that through surgery. It depends very much on the case, because sometimes they think that the extent of arthritis that's in the joint, actually removing the fragment is
it's going to be minuscule.
Yeah, not
And at 12, I could get the vet might have suggested it or not even suggested it, knowing that in this age category, people tend to be a lot less interventional and more conservative in their management. Yeah.
Yeah, if you've got a lot of secondary change in the joint, then it might be that just taking the fragment out is you've addressed the original problem, but actually you've got so many secondary issues now, it's not going to change very much the presentation.
No. Unfortunately, Katerina, again, you're going to have to make sure you've got a really good working relationship with your vet. Be willing to check in on a regular basis. You're not going to be somebody that goes to see your vet every 3 months anymore. You know, there's going to be a real honest chat of, well, we can try this and let's see what happens. And now let's try this and we can see what happens. I've got a case at the moment called Rumba. Oh my God, it's just hard work. But we chat probably every week to 2 weeks. Yeah. We're trying different doses, different frequencies, different combinations. We've, in the past, she's tried intra-articulars. We've tried acupuncture. We've tried. And unfortunately, none of us come with a magic wand, you know. And you hear about it in the human sector. I can remember meeting a guy walking his dog in the park, and yeah, I was like, "Oh, you're walking badly today." And he was like, he actually had what do they call it when they put the little batteries in the spine, so they permanently having like TENS?
Yeah, spinal cord stimulation.
And I was like, "Whoa!" And he was like, "Oh, I'm on loads of drugs too."
Yeah.
You know, so with all the will in the world, we do the best we can, but sometimes Mother Nature and how clever she is, we can't get on top of it, can we?
No, it kind of outwits us. Yeah, so far I've not seen any reports of spinal cord stimulation for dogs. I did inquire about it for one patient, but
did you?
Yeah. But so far, the neurologists that I've met haven't come across it.
No.
But you know, I can say that's where human medicine is going, and apparently getting quite effective results sometimes. So eventually, we tend to swap ideas with the humans, don't we? So.
Yeah, absolutely. So is it like a TENS machine that's actually plugged in?
Yeah, essentially. Although you're applying the current more closely to the nerves, so you're kind of modulating the nerve transmission, I think, at the dorsal horn more, rather than TENS, which is kind of more peripheral. Yeah.
Ooh. Okay, next. Help, please. My dog has hip dysplasia and severe arthritis. She copes really well. She's on end stage. Tried amantadine for 3 months, didn't work. Gabapentin made her back legs go, and 2 Librellas. She went manic and ruptured a. Oh, crikey! What should I try now?
Crikey!
I've not seen Librela. They did actually start saying that they were quite concerned at how good some dogs felt after it, and they overdid it. And their bodies were not conditioned for that sudden relief of pain, and them frolicking around the fields going, "Oh my God, I'm feeling pain," and then like, "Oh, my legs don't cope anymore."
Yeah.
So yeah.
Yeah, I guess that is definitely a consideration, isn't it? Is that, you know, these dogs have kind of been coping with pain for a long time. If you find something that really helps them, yes, they're much more comfortable, but their bodies aren't conditioned. You know, they're not up to athletic activity.
No.
And so it's possible for them. Equally, they don't have often the same level of control and, you know, motor function as they would have had when they were younger. Yeah. You know, they're older, the joints and things aren't working so well. So yeah, definitely we do need to be.
See, I would go back. I would clarify whether that manic that you were talking about was actually pain relief. And, you know, Librela, in my mind, wouldn't be contraindicated because it was doing what it was meant to do. It was just unfortunate that the dog became too active too quickly. But I do know from a more rehab sense and working with lots of orthopedic surgeons, the ruptured cruciate is a big conversation on its own. You know, that is something that needs managing either surgically, which we've got long-term studies indicating that is a very appropriate direction to go. But also, if that isn't a possibility, getting a good, solid rehabilitation plan to get stability back in that cruciate. Stability and function and flexibility. I'm going to leave you with Cartridge. You have a chat there. I don't know where you sit with that.
Yeah, I will often discuss Cartridge. I think, given its mechanism of action, it's most likely to be of most use in the very early stages of arthritis. So yeah, if you've got a young dog who, for whatever reason, has had a hip X-ray and they've got dysplastic hips, that's the time to start Cartridge. Once they start showing lameness, I think.
Yeah, and that's really hard, isn't it? Because that's like saying, I know you can't see a problem, but you're just going to have to accept that this could help. We don't know, but it might do.
Yeah.
And there's no crystal ball. I know a lot of people end up falling into the trap of using it off license once a month when actually it's once a week for 4 occasions, 3 times a year. And no one knows what kind of impact it would have in the long term.
Yeah, this is right. And again, the study that I'm aware of that's been published on it is quite old. Didn't use things like the pain scoring, things for the questionnaires, because they weren't around at that time. So it's probably ripe for looking at again, really. It might well be that it's a helpful product, but it's working out where it sits.
Yeah, definitely. And again, it goes back to what we were talking about, the handheld laser. That kind of information is not going to come out in the foreseeable future that we are aware of. So if you do choose to use it, have your wits about you. Keep a very, very open mind. Do not allow yourself to be biased. Use objective monitoring. But also, I wouldn't suggest it be at the top of my arsenal when I had been playing with other pharmaceuticals of a lot higher, how can we put it, intensity? No, it's not the right word. But if your vet's prescribing amantadines and gabapentins, they're thinking that your dog is centrally kind of sensitized. They're thinking that they're interpreting more pain than is being created. And Cartridge, I don't believe, fits that arena for me.
No, it's working at the level of the joint. Is how its mechanism of action is described.
Yeah. Oh, Luke. Subcut ketamine, when is it appropriate? Is it a good idea to kind of reset the pain nerve state? Also using galiprant, does it have an effect on soft tissue pain, or is it too specific? Oh, he's good. You see, he's a ambassador.
He knows more than we do.
He does know more than we do.
So, subcutaneous ketamine has anecdotal reports, I believe. I don't think there's any published evidence regarding its use. So again, I suppose in a similar way to CBD, ketamine's got a bit trendy. People are using it in human patients for depression and post-traumatic things, and talk about very marked, very rapid changes in depression and things like that. So obviously it can have very profound effects. In dogs and cats, I think it is described administering subcutaneous doses of it. I don't think we have more than anecdotal evidence at the moment that it's helpful, but there are, anecdotal reports that it's very helpful in some dogs, and they might have a regular weekly, fortnightly, monthly injection, and that seems to complement their kind of standard pain management therapy quite effectively.
If someone was going to do it, so let's try and be really practical about it, because as you say, it is trending, more people are doing it, and we don't want it to fall into the trap that someone pops into the vet gives it a subcut ketamine injection, says see you later, and then we never know, did it work, did it not work, is it something I should use frequently? So looking at the, I can't think of the right word, the pharmaceutical profile, what am I thinking of? Bioavailability, you know what I'm talking about. If it was going to work, how quickly would we expect? Because a CRI of ketamine, we'd expect to have pretty profound effect quite quickly. But using it subcut, are we expecting to see improvement within 24 hours, 48 hours? What's the cut?
Yeah, I would say 24 hours, really. And yeah, occasionally I'll use infusions of ketamine, so over a period of 12 to 24 hours for mostly dogs that have had an acute exacerbation of pain, or we are struggling to manage their pain with the kind of oral meds and things like that. And actually then in some instances, anecdotally, I have seen very good effects after a 24-hour infusion. So I'm sure there are benefits to using ketamine. It might be that those benefits are available from a subcutaneous administration. It might be that those benefits are following an intravenous administration. It might be that both are effective. Just don't know. But equally, in dogs, I don't think there's any evidence published for intravenous infusions of ketamine.
So it goes back to the old age of objective monitoring, not suffering caregiver placebo, having a great conversation with your vet, great communication with vet, be willing to try things. But I think I was talking to Tamara Grubb about it, and I think over in America, some people are using it more frequent than weekly. Some people, if they see an inkling of good in it, they're like, well, let's do every other day. Let's see where we go with this. So there's a huge amount of try and error, unfortunately. But what certainly shouldn't be happening with it is it being something that we resort to, give the animal injection, see you later. If a dog is requiring a subcut injection of ketamine because we're concerned about pain state, a follow-up is needed 24 to 48 hours later. How did it work? Or are we still in the same situation?
Yeah. And it might be that it does, in inverted commas, reset the nervous system and gives us an opportunity to address other problems. But then we need to make sure we've got that basis to address all the other problems. Otherwise, we're going to be back in the same position again.
Yeah, definitely. We were talking, who was I talking to? I was talking to a drug company today, and we're talking about the window of opportunity. We want to do this new campaign where you see the window, and everybody knows that a window, when you draw it as a child, is 4 panes, isn't it? Pain, 4 panes. And so you look through the window, and the 4 panes are the different, like, weight control, pharmaceutical, blah, blah. I was like, that's a campaign there. That's a
Good
campaign.
idea. Yeah.
I know. Don't steal it, anybody. Right, next one. Here we go. This is a long one. This question is relevant, but my 8-year-old Chesapeake Bay Retriever has recently been diagnosed with bilateral medial coronoid process disease. First sign was a very slightly intermittent lameness in the left leg. He is now sound on the left leg. Went noticeably lame on the right leg. Shows tiny fragments in the left elbow and possibly fissure in the right ulna. Specialist was hopeful that he'd be sound again and be able to come off his twice daily carb brief, but that's not happening. I'm assuming we can't see the rest of him, I'm afraid. You've written more, we can't see. Elbows, nightmare.
Well, elbows, nightmare, exactly. But again, it goes back to what we were talking about in the kind of secondary changes in the muscle pain, that kind of thing. Because if we can address that with massage, with physio, with acupuncture, then we might well be able to reduce the amount of analgesics that we're needing to prescribe for the joint pain. So that's definitely something I would look at.
I think not that it's going to make people, it's not going to give you a gift, guys, but it is going to make you sleep a little bit easier with yourself. Elbows are tough. And every lecture I go to, every conference I attend, every article I read, it is glaring. Elbows are difficult. And whoever smashes how to fix every elbow, they're going to do very well in life, because no one's got there yet, have they?
No, exactly. And, you're sort of on a losing wicket from the start. Dogs are bearing 60% of their weight through their forelimbs. So if we damage one of those, it's going to have more impact than a hind limb lameness.
Yeah, definitely. This lovely lady, this is, it is really difficult when there are these less regulated, more natural type approaches. I'm just trying to think some off the top of my head. The supplement sector with the boswellias, we've got the CBDs, we've got, there's all, 1 minute it was pineapple, one time it was fermented fish stock, there was, oh my God, rose hip was another one that showed itself, deer velvet antler, pine tree or something. There's just an array that I would love to say I understand. What I don't know.
No, I don't think anybody does. So,
no, and I think it's fair to be fair to your vet. They've said this is an area that is really unregulated. We are not qualified to talk about it. The evidence is very limited. And we wouldn't even be able to know how to guide you to find suitable products. So wouldn't it be really awful if they went, yeah, that works brilliant? No, I don't know where you get it because nothing's regulated. So it's kind of like obstacle after obstacle. But what you could do is ask if they would refer you to like a herbal vet. There's a number of herbal vets that have done further training, and the ones that I've spoken to, the lovely Vila, the lovely Chelsea Dawson, who have been on here. So please look up those lives. They are very much of the same ilk as me and James. If I implement something, I want to see effect. So I will check in. If I change something, I want to see effect. So that's who you're looking for. We're getting there. You don't know it. You've got 9 minutes. I like this. I adore my Helsinki pain score, which is linked to an owner app. I do pay for it, but it gives me grasp. Ooh! Where'd you get that? Tell me which app that is. Do you know of this app?
No, there was one that Zoetis did, which used the quality of life scale, but I've not seen one that's included the Helsinki.
No, I haven't. Let us know which app it is, please, Stacey. Hypothyroidism. Is there any chance he is metabolizing
painkillers faster due to type-4? I suppose compared to when he was in a hypothyroid state, then yes. Compared to most dogs with a normal metabolism, we wouldn't expect any significant differences. And it depends on which painkillers we're talking about, because some undergo metabolism and some are sort of excreted reasonably unchanged. So it may be that it's been a change for him. So if starting the Thyforum, which is the thyroxine supplement, has changed how he is doing, he or she, he, then that's definitely worth having a chat to your vets about. But we wouldn't expect him to be particularly different to any other dog.
No, and I think when you start having these comorbidities, be proud of the wins. So if you've got a dog that's hypothyroid, he's going to be lethargic, he's going to have poor quality soft tissue, he's going to be less physically able, his metabolism so slower, he's gained weight, all of this is so actually the fourth thyron is bringing him up, and then you look at managing his pain and adjusting that thereafter. I think a lot of people really want everything to be unimodal. They want one pill that does everything. But unfortunately, in this situation, you might find that your dog's on thyroid medication. It's making him feel better, control his weight, his metabolism is going to be better. And yes, what he was on doesn't seem to be kicking butt as much as it did. But so let's modify it. Let's add to it. Let's adjust the dosing.
It might also be that if he's wanting to move around more, that you're just more aware of lameness or a stiffness, whereas if dogs are hypothyroid, often they will, be lying around more and sleeping more.
Yeah.
Because they haven't got energy.
Right, we're going to do 2 more, because otherwise we're going to start talking gaga. I have a 14-year-old dog that has lots of arthritis, can't take other pain relief apart from paracetamol. I'm a massage therapist and a low-level therapist. I use these maintenance and floats. I've spent a long time researching CBD, as I knew it would be at some point the last option in her for terms of pain relief. I took the plunge 7 days ago and tried a combo. Early days, but we're keeping going. Okay, cool. No, that's good. Yeah, and that's exactly what we need to do, is use people that have good contacts. They've looked into a company. They know whether they've got certificate of analysis, consistent products, reliable. And then, as you say, you've got to be monitoring. At the end of the day, none of us want to leave them suffering in silence, which is what our video is. I would love a copy of that link to that online question. Yes. So Stacey, tell us. Oh, the online. We're talking about you. Carrie's talking about your version of Load. I think Load's back online. I heard from my boss it's back online.
So yes, the issue with to get a little bit geeky for a minute. So the issue with transcribing validated pain scales into a different form is that they've only been validated in the form in which they are originally presented.
Yeah.
So the Helsinki on a piece of paper. So what we don't actually have the evidence to say is that if I've created a form which has all the same questions as Helsinki, we don't actually have the evidence to say that it will detect dogs with arthritis in the same way, or chronic pain in the same way, or that it responds in the same way when they're treated with painkillers and things like that. So it's a bit of a geeky point, but ideally we should be using as close as possible to the original questionnaires. And
yeah, definitely.
There's obviously considerations around licensing of some of these questionnaires as well, because some of them are commercially licensed.
Oh God, I should have pressed that button. There's reams. We're not going to be able to do all this. Guys, I'm going to actually just pause, let James reboot his brain. This is what we're trying to do in the member zone. Okay, so this is a little tantalizer of CAM's progression. We now have overheads that are going through the roof. That's terrible. And to remain independent and offer this service, we have got to look at all ways to fund the overheads. It's about £6 to £7 grand a month now to try and keep this going. So we have a member zone, and one of the perks of being a member in the member zone is that you have a tea and chat opportunity once a month with me and a guest. So this whole formula that you see here is basically happening on a monthly basis within the member zone. And I would really encourage you to see benefit in that. We are working very much in the human model, where if we help the owner, we help the dog. If we help you emotionally, cognitively, physically, we're going to help the dog. So, supporting you with the trials and tribulations is very much part of giving you black and white advice. So that is now available. It is a ridiculous bargain. It's 25 quid a year. But if we can we're aiming for 100 sign-ups a month, then that is going to cover half of our current overheads per month. And it means that we remain independent, which is really a massive necessity for us to be able to offer this advice. So please bring these questions over into the CAM member zone, and we will do the best to help you. I'm loving the beautiful conversations that is going on. There are so many people looking after each other, which is great. I am going to pick the last one, who is, I just want to showcase this lady. Okay, we're just going to pause. Laura ran the big walk. She was head of logistics. I can't speak. And coordinated the whole big walk, which, if you didn't go, was absolutely mind-blowing. Thank you, Amanda Perryman, Rachel Hazley, and Laura Eldridge. Absolute stunners. And one of the things that keeps me going with CAM, because it is a complete nightmare a lot of the time, is meeting decent souls like this who give up their time for free. So Laura, you're lovely. Right, Mayhem is a 10-year-old Labradoodle. She has mild spay incontinence as well as spinal arthritis. I've noticed she seems more likely to have accidents when her back is sore, flaring. Is there a link between back pain and incontinence? If so, do you think some dogs may be misdiagnosed and back pain being missed? Could incontinence urinary accidents be used as a pain of... I love that. I love that. But how do we unpack that?
Yeah, I would say that, you know, if a dog's got back pain, they're probably less inclined to go outside for a wee. When they do go outside, you know, if it's a bit and she has to squat down, when she does go outside for a wee, she may not empty her bladder completely. Yeah. So then once she comes back in, there's some residual urine, and you may then see an increase in the incontinence, is what I would hazard a guess is most likely happening.
Yeah, I think there was something about, there was a chiropractic study in urinary incontinence that's coming out the back of my head. It was in the vet record about 5 years ago. And they did a small case series looking at urinary incontinence and influenced by, where did that come from? But no, I'd be the same as you. I can't think of a mechanism other than overflow. I
guess the opposite thing is, if, you know, in people and probably in animals who have sort of like a chronic cystitis, so an inflammatory condition of the bladder, it's possible to develop referred pain, so pain that does spread up the back. So it might be that there's an inflammatory condition within the bladder, and then because of that, you've got back pain secondary to that. But in terms of the kind of sphincter mechanism incontinence, then I would say it's most likely, you know, they're not, if they've got a sore back because of a spinal arthritis, then she may not be emptying her bladder completely when she's squatting.
That's what I can think of. This makes me very happy. So hello to Sam for me. Sam is a very epic soul in the pain management.
Oh, brilliant.
Does she train you? Yeah. I've just done my electroacupuncture section. I've now got to bring it all together and start using it. Sam Lindley is a very inspiring lady, very busy. Well, isn't everybody busy? This has been lovely. It's been way better than I ever thought. I thought we might be trying to ourselves.
Yeah, no, great questions.
Really hard questions.
Really hard questions. I guess the other, just thinking a bit more about the whole ketamine situation, is that we know in people who abuse ketamine, and well, it was bladders that brought it up. You know, there are side effects that you wouldn't expect associated with ketamine, like a bladder inflammation associated with chronic abuse in people. So if we are starting to give the drug frequently to animals, you know, maybe we need to be starting to look out for things like that.
To be honest, that's something that I'd love us to do. One of the things that we're really trying with the website and the member zone is to look at common problems and try and integrate it. So we want to have a way for people to report adverse events easier, because it's not the VMD site. It's just a bit daunting for people to go into a government site. It's pretty crisp. It's dry. It's dry as you like. And we're like, could we make a introductory page that links to it, saying, look, guys, don't be scared of this. You're working for the next generation. So your 5 minutes of dry form filling is going to have such a profound effect for generations to come.
The questions are quite intimidating on when you complete one of those forms. So yes, if you do see an adverse effect that you think might be related to a drug, you should complete a report form to the Veterinary Medicines Directorate. So they're the people who regulate the licensing of veterinary medication. But it asks you how many were affected, how many died, all these kinds of questions that are but yes, it's such important data. So, you know, one of the studies I worked on when I was, you know, working at Bristol was used data from that to try and get a picture of the level of adverse events associated with non-steroidals. So, and one of the issues was that actually the data, as good as, you know, we could get it, didn't tell us everything that we wanted to know.
No. And I think one problem is time. I think, you know, acknowledging it's there and thinking, yes, I've heard, now do. The array of adverse events, and an adverse event isn't causative. You know, it's just an adverse event that happened to coincide with giving a medication. And I think people need to know that, because almost when you go and do a government form, you're going, oh, I've definitely had to make sure it's linked. I don't know if it's linked. It might not be linked, but actually it's just about reporting. And the data, if we have enough of it, will filter the chaff from the cheese. What's the phrase?
Wheat from the chaff.
That's the one. The chaff from the cheese. Because if we have huge amounts of... I'm tired. I'm really tired today. So we should all be filling it in, because we will all benefit from what comes from it. And even if you're sitting there going, oh, I don't know if it was causal, it doesn't matter. An adverse event is just anything that coincides with implementing a drug plan. Just in case it is. Right. I think that we need to call it a day, because I'm going to say something equally stupid in a minute, aren't I? I'd like to say a massive thank you to James, and I want all the 35 people that are still with us. We know we got up to about 67 people listening at one point. I would like you to take a couple of seconds to say thank you to James for giving up his evening. It's lovely, haven't you? Lovely.
I love coming. Great. We have a lovely chat.
We have lovely chats. And we're going to hopefully, I'm going to persuade James to come over into the member zone and do more stuff over there. But what we want to do is we want to bring the world of CAM and get it into a member zone that has all of these discounts and resources and tools and videos and articles, because I want us to remain this independence, this individuality, which we will lose if we have to start relying on sponsors, sadly.
Yeah.
Amazing. So thanks, James. I'm going to go and have some apple crumble.
That sounds great.
Mum's here. Cool. Take care, guys. See you later.
Thanks, everybody.